Bismillahirrahmanirrahim. Role of primary care physician to elimination of viral hepatitis. I have nothing to disclose. Globally, infection of viral hepatitis is caused by hepatitis A, B, C, Delta, and E. All the viruses causes acute hepatitis, while hepatitis B, C, and Delta also causes chronic hepatitis, liver cirrhosis, and liver cancer, that is HCC. Approximately 325 million global population is infected with the viral hepatitis B and C, out of which HB is around 100 million and the HCV is around 225 million. Out of 325 million, 290 million people are still undiagnosed. And these are known as the missing millions. Means 9 out of 10 are unaware of their diseases. And these are known as the missing millions. Pakistan is the 6th most populous country in the world. Pakistan total population is 22 crore. And the population infected with the viral hepatitis in Pakistan is about 15 million. Out of which 10 million is about hepatitis C and the 5 million is about hepatitis B. So it is 6th most largest country, but in hepatitis wise, related to the hepatitis C, this is 2nd most country in the world who is having highest prevalence of hepatitis C after China. Though the Indonesia, USA, UK, India are larger countries, but the prevalence of the hepatitis C is less than the Pakistan. Patient treated per year, estimated viremic prevalence is about 3.9% and estimated diagnosis rate is just 14.7%. Estimated treatment rate is 1.2%, means estimated number of patients treated per year is just 85,000. However, given the fact that Pakistan is estimated to have over 7 million chronic HCV patients, their treatment rate is only 1.2%. Out of 100 patients, just we are treating 1% of these patients. In 2013, in world, the death was increased due to viral hepatitis. In single year of 2013, about 7 lakh people died due to hepatitis B and hepatitis C. World Health Organization sought out that what is the cause of this and formed a strategy. And this was the number more than the HIV, equal to the tuberculosis, and more than the death by the malaria. Then World Health Organization formed a strategy known as the Global Health Sector Strategy on Viral Hepatitis and given a target up to the year 2030, in which they targeted that 90% of the infected population being diagnosed by 2030, 80% of those whom are diagnosed and eligible being under the treatment, 90% newborn vaccination, 0.1% prevalence among 5 years old, and 65% reduction in the liver-related deaths. And these are the targets set by the WHO. If you see the HPV vaccination, that is about 90% of the target in 2020 and 100% in the 2030, but Pakistan is lacking behind. Prevention in maternal transmission, that is 39% in the world, 50% is the target in the 2020 and 90% is the 2030. While in the diagnosis of hepatitis C is now it is 20%, while the target is 90%. And same is the case with the hepatitis B also. So these are the targets which are set by the WHO. To reach these targets, they found this strategy. Success story of the Egypt, we have to adapt to eliminate the viral hepatitis from the country and from the world. In 2015, HCV prevalence in Egypt was 6.3%, and the total population of Egypt was 93 million. And burden was 6 million. 60 lakh patients were suffering from hepatitis B and C. and the prevalence of hepatitis B was just 1%. What they did in May 2019, 50 million people were vaccinated, means more than 50% of their population was vaccinated within a period of 6 months. This type of study is needed for Pakistan also. There are many stakeholders to overcome this issue to eliminate the viral hepatitis from the world. The main are the primary healthcare physicians, which are known as the GPs, hepatologists, nurses, and the paramedical staff, community, NGOs, civil society, authorities, pharmaceutical companies. I yesterday see the data of number of doctors in which are registered in DPA. Total number of doctors registered up to 20 is about 1,90,000. Around about 2 lakh. And the population is 22 crore. If you 2 lakh, 2020, and our goal is 2030. Over a period of 10 years, each doctor has 1,100 persons, out of which they have to decide, they have to vaccinate, they have to diagnose, they have to educate the population. But all the doctors are not involved in this type of elimination system. So just take example, if we take just 10% of our Pakistani doctors, primary care physicians, that is about 20,000 on the right side you see. So each doctor will have about 110 patients over a period of 10 years. So in 1 month, each doctor will have 100%. So it is very easy if we educate our doctors, primary care physicians. Over a period of 12 months, one doctor can see just 100%, and in 1 month, just 9 to 10 patients per month. So before giving role to the primary care physician, education of these is must. So educate the primary physician care for screening, vaccination, diagnosing, treatment of viral hepatitis, and educate these primary care physicians through these seminars, online webinars, WhatsApp, mobile, social media, Zoom meetings, through celebrities, through newspapers. You have to involve all these. First of all, you have to educate these because they are having less knowledge. If you educate first them, then you have to assign these people, primary care physician, these type of tasks. Then they will help because these are the backbone of our healthcare system. Primary care physician will play a major role in the implementing the plan, not a clinical guide on the hepatitis treatment, but focuses on improving screening, diagnosis, linkage of patients to care, and treatment after diagnosis and public health management. It includes 6 parts: educating clinician and the public, improving testing, care and treatment, strengthening surveillance, eliminating transmission of vaccine a preventable viral hepatitis, reducing viral hepatitis caused by drug use, protecting patients and workers from the health care associated viral hepatitis. All party parliamentary group on hepatology, APPG, the recent publication Eliminating Hepatitis C in England in March 2018, which includes several suggestions around how GPs can contribute to this shared goal. APPG's suggestions are increased awareness of HCV among primary care professionals. There should be opportunities for GPs readily access educational information as a part of CPD, with resources on hepatitis C being produced for primary care workers. Testing should be widely available in the primary care plans to promote an annual HCV testing week. In the medium term, GPs should be prescribing and delivering treatment directly. These are the risk factors. Every GP primary care should know multiple therapeutic injections, unsafe billiard, reuse of syringes, previous surgical procedure. These are the risk factors which are discussed repeatedly. Main prevention measure of the hepatitis B and C: promote vaccination against hepatitis B, avoid sharing injecting equipment such as needles and syringing, and ensure adequately sterile medical equipment use. Promote hepatitis B and C testing and counseling services, raise awareness of the disease and their transmission mode. Individuals up to 18 years of age and adults participating in the risk of infection should be vaccinated. The injection dosage should be given 016 or 012. Unnecessary injection in the Pakistan mostly by the primary care physician, because if you remember, 80% of our OPD is received by the primary care physicians and the clerks. And there is unusual usage of injections. Over 1.5 billion injections, means 13.6 injections per person per year is used, out of which few are for immunization, but 90% of these injections are unnecessary. And these are the primary care physicians who can withhold these type of practices. And because these are the primary care physicians who are using this, and we have to advise them, don't use, because this is the main source of transmission of hepatitis. Screening recommendations: it is critically important for physicians that the primary setting to be aware that the majority of people with the viral hepatitis are asymptomatic and don't know they have the infection. These are known as the missing millions. They should order screening hepatitis B and C. That's for all their patients. There are many types of screening. One is known as the mass screening, and second is the mandatory screening. In mass screening, you have to divide into 3 phases: first phase, second, and third. In first phase, you have to take, GP should take the high-risk group like the doctors, nurses, paramedical staff, IV drug abuser. And in second, the persons which lives with these people. And in third phase, rest of the general population should be involved in the mass screening. Then in mandatory screening, like the special group, you have to take anybody who is going for the service, like for the job in the army, job in the police department, or a service admission in the medical college, or patient who is going for a delivery, like in the female who are pregnant going for the visit to the gynecologist. These are the special group. They should primary care physician should know regarding this screening. Indication of hepatitis B vaccination is the hepatitis B immunoglobulin and hepatitis B vaccine to infants. Mother positive, HB surface antigen positive mothers should be given. And these primary care physician must know that they, because our WMOs, our gynecologists, most are, these are just MBBS, and majority of vaginal deliveries and cesarean sections are done by these primary care gynecologists. So they are advised to routinely do screening test of every pregnant mother. Those who are positive should be sent to the consultant. Those who are negative should be received hepatitis B vaccination. Those who are positive should receive advised to vaccinate the neonate within period of 12 hours and should receive immunoglobulin injection within 12 hours. These are the high-risk groups. Benefits of improved hepatitis B screening: earlier treatment of liver disease to prevent serious long-term sequelae, implementation of long-term surveillance SCC, identification of patient receiving immunosuppressive therapy, and etc. So recommendation of treatment, I will not advise for hepatitis B treatment, but hepatitis C, previously it was difficult to treat at GP level, but now due to the availability of the DDAs, direct attack, which are about 95 to 99% curative. So I will advise, we have to advise these GPs to treat hepatitis C by screening first, then do the PCR, then they have to advise antiviral. But they should leave the special group of people like the children, pregnant female, co-infection, they have not to treat. This is a study done in the JAMA that shows how we reach our target, and they show that about 9 lakh people should be diagnosed in 2018, and out of this 70,000 should be treated. And with this, if you do this level of diagnosis of 90% and treatment of 70%, we will reach our target by 2030. But at present, we are just diagnosing 14% of our patients, which is very difficult. We will reach our target by, I think, 2050 or 2060. So we have to enhance our diagnostic tools and treat our patient by seeing this study. Hepatitis B, I will not suggest that the GP should treat these of patient, but just after screening, they should refer these type of patient to the consultants. Conclusion, primary healthcare physicians are backbone of the healthcare system in the elimination viral hepatitis from the world. It is recommended that the primary care physician should be educated regarding risk factors, screening, vaccination, management of viral hepatitis. Then they should be assigned their role in screening, vaccination, and treatment of viral hepatitis as eliminated from the world and 2030 goal is achieved. Thank you very much.
My topic is what is the role of hepatologist in elimination of hepatitis. I have no disclosures. Now we have a target given to us by WHO, and we know that in Asian region accounts for 70% of the viral hepatitis related death globally. Now, effort of hepatitis elimination is not a duty of hepatologist alone, but is a combined team effort of primary physician, hepatologist, infection control personnel, government authorities, NGOs, by diagnosing, treating, providing drug and education of the public. From the hepatologist perspective, the role of hepatologist is like infectious disease specialist, but the hepatologists are more familiar with the liver disease and are providing specialized care for a patient. We know there are 5 strains of viruses causing hepatitis, differing in mode of transmission, severity of illness, geographic distribution, and prevention method. But here we are concerned with type B and C chronic liver disease, which are the most common cause of liver cirrhosis related complication and death. What hepatologists do is perform a careful evaluation of patient coming with hepatitis that includes history, physical examination, and standard laboratory evaluation. Important thing is the timely diagnosis, which is crucial for disease prevention by detecting the disease early and to treat, thus to reach an elimination target. After risk evaluation and diagnosis, treatment is offered. Then hepatologist informs infection control personnel, and information are passed on to the government authorities who set up priorities to plan for prevention and treatment. One of the key to elimination is identifying people who have the disease and making sure that they are appropriately linked to the standard of care, and to realize authorities to how to interrupt transmission of this infection by checks on prevention method, especially in the risk groups. People who have access to the, people should have access to the vaccination and provision of cheaper medication, which is now possible and it is in the practice. And we know that there is no cure of hepatitis B, is just suppressing the virus. But in the case of hepatitis C, we need to treat all the patients to achieve hepatitis elimination. One of the important thing is for the barrier to eliminate hepatitis is insufficient public awareness and modes of transmission leading to the underdiagnosed and high rate of transmission through medical exposures, limited access to care for patients with IV drug abuse, and prevailing stigmata, discrimination against people who are infected with the hepatitis virus. And still we find financial barriers in spite of the fact that the hepatitis drugs are now available to everybody. Then important thing is the public awareness by frequent talk shows, seminars, use of social media, public NGPs, and I'm happy to inform that PSSLD is doing much on this topic. This is my last slide. Hepatitis elimination is a combined effort of primary physician, hepatologist, infectious disease infection control personnel, government authorities, NGOs, and the society. They for the diagnosis, treatment, provision of drug, and education of the public. And hepatologist has a key role to play in keeping viral hepatitis on the healthy agenda, on health agenda. Hepatologists advocate for the prioritization of viral hepatitis prevention, treatment, and elimination by providing high quality data and simple, consistent target to monitor the progress. And thus, by these combined effort of everybody, we can meet the WHO target of 90% reduction in new infection and 65% reduction in death attributed to the viral hepatitis by 2030, which is still possible. Thank you very much.
So the roadmap of my talk is one is the objective, evidence on spread and control of hepatitis, chain of infection and how to break the chain, overview of infection control program in hospital, and then summary. The objective of my talk is that by end of the session, the participant will be able to understand the role of infection control program to minimize the infection in the viral spread of hepatitis B in hospital. And I will start with just saying with this quote of Florence Nightingale that it may seem a strange principle to enunciate as the very first requirement of a hospital that it do the sick no harm. And as we are already knowing that spread of infection in hospital, particularly when we talk about B and C, the C is with blood transfusion and the unsafe injection use, meaning the reuse of the injections or the equipment. And the second important part of spread is the spread from mother to infants. So what the unsafe injection practices, injection and the accidental needle stick injuries. The guidelines which were there in 16, that the risk of infection varies depending upon the frequency of medical procedures, the level of infection control practices, and the high prevalence of HCV infection result of the high frequency of injections and the low level of infection control. And the important thing is that whenever we talk about the hospital-acquired infections, about 70% of the hospital staff is periodically or constantly been exposed and contact-related to blood, while doctors 0.7, support staff 1, and the nurses 1.3 exposure per year. So this is the data which is very alarming. And whenever we talk about the infection control in hospital, the study from Nigeria is just saying that serious efforts are needed to improve or review curriculum that health science students' knowledge on infection and prevention control is imparted early before they are introduced to the wards. So this is a very important message. And when we talk about the reuse injection, this is a very, very important data that 16 billion injections were given in that study, and these injections were leading to 21 million new hepatitis B infection and about 2 million new hep C infections. And the burden of these infections were more in developing countries, so-called developing countries. And this indicated the need of improvement in surveillance and infection control program. So this is the background on which I'm talking. And if you see the data from Pakistan, and it is from Islamabad, that the 65,000 blood donations, only 65% of the collection was just collected in 2 out of 19 licensed blood banks, and only 8% were from non-remunerated blood donors. Like it means other was from the professional donors or from the family members. Now, if you see the chain of the infection, because we are going to talk first on it, I think nowadays everybody is knowing about the chain of infection. Even the rickshaw driver is knowing about it, and the maid is knowing about it. But what is our task? How we are going to practically implement this chain breaking over there? So how can we stop it? Just breaking the chain will be breaking the infection spread, particularly what we're talking about hepatitis. So this is infectious agent, reservoir, portal of exit, portal of transmission, portal of entry, and susceptible host. If you see, I'll be just completing in these 4 or 5 slides, that if you talk about infectious agent, we should have screening of all the indoor patients over there if we want to break the chain at this level. When we talk about the reservoir, then we should be talking about the environmental sanitation. We should be talking about the disinfection and sterilization. And we should be having the collection of the evidence that what the number of people in hospitals are having the infection. Hospital implying number of people who are having infected with HBV infection, HCV infection. So that's how we will be having data that what number of employees are having it. And if we want to break at the level of portal of exit, then we should be talking about the proper attire, control of excretion and secretions, and it is important to deal properly with the trash and the waste disposal. As we all know, that if person is having Hep B and having vomiting with upper GI bleed, which is very common over there in medical wards, then how it should be controlled, because if we are not taking proper care, it will be transmitting infection in the hospital employees. When we talk about the mode of transmission, then it is important to isolate the people. And this I'm particularly talking about HIV patients. And we are also applying sterilization and hand washing when we want to stop the transmission. So it means it is equally important what kind of infection is there. You should be applying hand washing and sterilization. And when we talk about the next level of this chain, and that is the portal of entry, all the procedures over there in the hospital should have the aseptic techniques. And second thing which I have put over here is the screening of the blood and blood products, because we know that this is the very important mode of transmission of B and C. And if hospital, it depends upon how much procedures are there, how much people are coming over there. So screening is again a very important tool if you want to break it. And when you are having the host, you should be diagnosing disease. We should be taking proper care of the patient as far as treatment is concerned. So that's how we can break the chain, keeping in view the chain of infection. But how can we actually implement it? For this, we should have a proper infection control program, and in which your role is very, very evident, as in a few slides that there. So the infection control committee is comprising of doctors, either maybe physician, it is definitely physician, infectious disease specialist, surgeon, clinical microbiologist. Center of it is infectious control, nurse, and representative from all other relevant departments. It may be the laboratory people, housekeeping, pharmacy, central supply, and administration, which is important again. And now if we talk that what are the responsibility of the infectious control program, it is development of a manual of policies for aseptic techniques, taking into account the WHO and the national policies. And then we should have a targeted surveillance of viral hepatitis. And then we'll be having data, and then we'll be analyzing the data. Then we should be advising staff to maintain a safe environment. And then we should have supervision and monitoring of the cleanliness. Along with it, we should be monitoring the use and quality of controlled disinfectants. It means we should have the quality control people over there. And at the same time, we should be having supervision of isolation procedures. We should investigate the outbreaks. We should be keeping the people in isolation if it is HIV in the form of hepatitis. And again, very important and very neglected part of the process is the waste management. Incinerator provision in every hospital is important. It is there now in Punjab, but how they are working, this is again a big question mark over there. Then all these things will be implemented through training of all the new employees, regular training program for staff, audit of the hepatitis control procedures. So if we are keeping all these things, we can just execute what we have discussed in breaking the chain of infection. And if I just take in one thing, that multimodal strategies are being taken by the infection people. It is by building the environment, providing the material and equipment, disinfection program with taking into account the workload of the staff, by putting the proper staffing over there, keeping in view the bed occupancy, and it will lead to what? The provision of the guideline, education and training, surveillance and monitoring, audit and feedback. With this, we can have a very proper control as an infectious person, infection control team person over there. And I will end my talk by just conclusion that viral hepatitis transmission can be minimized by adopting the infection control program in hospital, mainly by guideline, educating and training, surveillance, monitoring, audit and feedback. And it will be only possible if all the stakeholders are working properly and taking into account what the guidelines, national, international, and local are committing over there. I'm again thankful to the organizers